So cortical visual impairment, which is called CVI, is a much more common diagnosis in children that have vision impairment. Probably the reason is that it's associated with premature infants, and as many people know, premature infants are surviving in greater and greater numbers than ever before. These kids are born at very low birth weights and very early, and because of the excellent care, we're seeing them live into childhood and adulthood. And many of them have injuries to the brain, and particularly areas of the brain that are associated with vision and vision processing. Probably the commonest association of brain damage and cortical vision impairment are infants or young children that have lack of oxygen to the brain, or the medical term is hypoxic ischemic encephalopathy. Another common cause of cortical visual impairment seen in premature infants are infants that have a bleed or a hemorrhage in an area of the brain called the ventricles, which is the area in the brain that contains a fluid-filled structure. And just to the side of the ventricles is a stream of the visual system that goes straight back to the cortical area, the most posterior part of the brain, that, if you will, is like the computer in understanding what vision, understanding what information comes in visually. Other less common causes of cortical visual impairment are seen in children that have had infections in the brain, such as meningitis, children that have had strokes, which is rather uncommon, but some children, when they're still developing in the uterus, can have a stroke, in which case they have a cortical visual impairment that is more like the type that we see with adults. You can also see this with diseases that cause brain degenerations, such as metabolic disease or mitochondrial diseases, or children and infants that have had actual trauma to the brain, such as children in ATV accidents or motor vehicle accidents. The diagnosis of cortical visual impairment is not straightforward. And it is based on, number one, having an appropriate medical history. That is, you'd want to see a child with a history, for example, of prematurity, or if you know that there's a history of brain trauma or stroke. Secondly, there are usually symptoms that are associated with cortical visual impairment that will be discussed in another part of this videotape. And thirdly, there are some supporting tests that can be done. And the most common test is magnetic resonance imaging, or MRI. When you look at the MRI, you'll see that there is damage in either the very posterior part of the brain or in the areas that are next to the ventricles. I mentioned before that you can have a bleed or a hemorrhage inside the ventricle, and this can cause a softening of the area next to the ventricles, and this is called periventricular leukomalacia, or PVL. It's a very common term that you'll hear in association with CVI. So it's the combination of history, visual symptoms, and supporting information such as damage found on the MRI that helps us make our diagnosis of CVI. In most children with CVI, but not all, there are other problems with the brain and with neurological functioning. For example, a child that's been deprived of oxygen early may also have cerebral palsy, may also have significant developmental delays, cognitive delays, and in particular may have damage to the anterior part, the front part of the visual pathway. The anterior part of the visual pathway may include the eyes, the optic nerve, which is the nerve that attaches the eye to the brain, the area where the two nerves join and then stream back toward the brain. And so I mentioned that diagnosis is difficult because there are often other diagnoses, other problems that these children have. And it makes it, very few children have only damage to their visual cortex or to the posterior part of the brain that deals with vision. So how is it, who would diagnose this? Usually it's diagnosed by a pediatric ophthalmologist, and often in a university setting, but not always. It's important to diagnose CVI early because although not everyone shows an improvement in their visual function or in improvement in the damaged areas of the brain, you can develop strategies for educators and for caregivers, for parents, so that kids can work around their deficits. There's an obstacle because there may be damage, and yet if you can identify the particular areas where the kids struggle, you can work around that once you've identified what the problems are. Why is this important? It's important for self-care, it's important for education, it's important to just for any child, that we want them to become more independent and able to function in multiple different kinds of environments. So the earlier we diagnose it and the earlier we give them strategies to work around it, the better chance that they have of having a full independent life. When a parent visits an ophthalmologist or an eye care practitioner, there are several pieces of information that are important in terms of vision function. One thing is the ability for a child to pay attention and to see if there's a difference in vision between the two eyes. Visual acuity, or the ability to see fine details, is something that might be assessed in older children or even in younger children with special techniques called grading acuity. This isn't available at every office, but it does give some estimate of how small an object a child would be expected to see. The other thing that's critically important is visual field, and that is, is the peripheral field of vision, the side of vision, and especially inferior vision intact. This is important for things, as you can imagine, like walking, being able to see down below, for eating, being able to see the plate or your food on the table, reading, so in an instructional setting. And this is something that is often missed. The other thing that you want to look at, that you'd like to know about, are eye movements and how the child uses the two eyes together. Is there depth perception? Is there 3D vision? This helps in eye-hand coordination and also in mobility or walking independently. And how well does the child control their eye movements? Often children with cortical visual impairment will have cerebral palsy, and in a small group of children with cerebral palsy, there's very poor control of intentional eye movements. I think the other thing parents would want to know is whether the child has a condition that is progressive. What's the prognosis? Is it possible to see improvement in visual acuity or visual function? Would glasses help? In many children with cortical visual impairment, simply giving something the equivalent of a bifocal that an adult would use can improve visual functioning at near. I think parents also should understand that there are limitations of what an eye doctor, of the information an eye doctor can give them. So for example, functional vision information, that is how a child functions in a setting that might be educational or at home, is really beyond the scope of an exam in a doctor's office. And on the other hand, the doctor should be prepared to do an appropriate referral for a functional vision assessment and for educational services, and that's something that should be agreed upon before the parents leave. That is, that a letter will be provided with the child's diagnosis, the child's prognosis, an estimate of visual acuity, and the statement that this child is qualified for the services of a vision teacher.